Understand, I'm going to do an opening prayer. Dear Heavenly Father, I'd like to thank you for allowing us to be here this morning. We ask that you allow us to make decisions that would best consider our constituents. We thank you for our arrival, and we ask that everyone leave safely. In Jesus' name we pray. Amen.
Amen.
We can get our chancellor, Mr. John Gallant, please, in the pledge.
I pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I wish y'all cut her off there. Delayed on the phone.
First up, okay, yes, we have Mr. Supervisor Rockwell on the line. First up, consider all the damage claims of Tyron Plant.
I'll make a motion for discussion.
Okay.
Supposed to be a second.
Second,
I'll second it for discussion.
okay.
This one seems to be our responsibility, I think, so I don't have a problem.
Yes, I agree.
Get a motion to pay the claim.
So moved.
Second,
Second.
okay, all in favor of that motion, say aye. All opposed?
Aye.
Motion carries. 2, order approving salary supplements for certain state and county employees in the district attorney's office pursuant to section 2531.101 of the Mississippi Code, effective October 1, 2022, as on file with the payroll clerk and personnel department. The supplementary salary expenses and fringe benefits shall be paid from the Second Circuit Court District Attorney's account, and there will be no financial impact on the county clerk.
Motion.
So moved. Second.
Okay. Any further discussions? All in favor of that motion, say aye.
Aye.
All opposed? Motion carries. Items 3 through 4 is placed on the consent agenda, same depending routine and non-controversial matters, which our supervisor would like to agree.
Motion.
Second.
Second. Further, any discussion? All in favor of the motion, say aye.
Aye.
All opposed? Motion carries. 5, order acknowledging receipt of and approving petition for the 2020 real property roll as recommended by the tax assessor.
Motion.
Second.
Discussion? All in favor of the motion, say aye.
Aye.
All opposed? Motion carries. 6, order acknowledging receipt of and approving petitions for decreases to the 2022 real and personal property roll as recommended by the tax assessor.
Motion.
Second? Okay. Any discussion? All in favor of the motion, say aye.
Aye.
All opposed? Motion carries. Order 7, order acknowledging receipt of and approving petition for the increase to the 2022 real property roll as recommended by the tax assessor.
Motion.
Second.
Second, discussion. All in favor of the motion, say aye. All opposed? Motion carries. Also, I want to skip over, if I can get to it, so we can get Chief Opinion up. I know he's been here a while. We may have to get back to the airport office. May have some storm stuff to talk about. What time is that?
We're good.
I don't think he's on here yet.
Yeah, I think we just had, you didn't include it on there. It's coming up with this.
I would
meeting
move
discuss.
to amend the agenda to have Chief Opinion and Angela give a report on the field.
Okay. All in favor of that motion, say aye.
Aye.
Opposed? Chief, you want
Good morning.
on?
First, I'd like to thank the board for my appointment to Region 12. And, you know, there's been a lot of angst with where we are with mental health, and I kind of wanted to go back in time a little bit and set the stage on what my approach is going to be to this position. If you go back to 2016 when the sheriff and Chief Miller and I first started expressing concerns about a lack of a single point of entry, as our conversation had started back then, as we delved in to the state of mental health in our community then, some unfortunate circumstances came to light about how Gulf Coast Mental Health was being operated. And the board suddenly realized it had a bigger problem on hand than simply finding us a single point of entry. And as we delved into that, without reliving all the stuff we did, it was a mess. And ultimately, it was suggested to look at Region 12 as to how they operated and see if something similar could occur here for Region 13. And ultimately, I think the board decided to let's dissolve 13 into 12 and operate under Pine Belt. And Pine Belt took it over. And I believe Pine Belt has corrected the issues of the operational running that we were seeing in Gulf Coast Mental Health. I think Supervisor Ladner, I know you had took a deep dive into the issues, and if you remember, one of the main things that had occurred is a lot of the personnel had lost their credentialing, and we couldn't bill anymore.
Couldn't get reimbursed.
Yes, sir. And so, in regards to has Pine Belt lived up to fixing those parts, I think they have. And it's interesting because they kind of fixed all the problems back to getting us back to where we were with our other problems. When you think about it, back where we were in 2016, we still don't have a single point of entry, and I'm going to speak a little bit on that because it's important we understand these different components as we talk about what's wrong in our community with mental health and what is it we need going on. And a single point of entry is part of the crisis intervention training. And when, and I'll say police and fire now because we're training some of our firefighters on CIT also. When they engage a person in crisis in the community and they determine that they can't help that person avoid or move away from crisis, and if an MCERT team can't come on the team on there, and they've decided that this person may need to be taken for mental health, the ideal situation is they go to what we call a single point of entry. They don't go into our ERs. The way we do mental health in our community is probably the most expensive way to do it, but we're not unique there. We just returned from Kansas City, and while we saw a really good model there, they're still taxing their ER rooms with the crisis too. And so not having that single point of entry is, to me, the tip of the iceberg. As we talk about a need for bed space in our community, while I don't disagree there's a need for additional bed space in the way we do business.
When you say bed space now, are you talking about
Committed
the
bed
CSU?
space, yes,
You're
sir.
talking about the CSU?
I'm talking about when someone gets committed somewhere to put them, that kind of bed space. What we observed on our Kansas City trip and what I've observed in my time with Oceans Healthcare, looking at how it's done in other communities, and what we have an opportunity, because the board is contemplating a model right now, is we have to look at the opportunities of diverting people away from a need of committal, going into crisis. Because quite honestly, that's the most expensive route of engaging them into mental health, is we got to commit them, then we got to find a place, and the models we saw in Kansas City were diversion models. It was places where people could be brought to or arrive to, and as they're moving towards crisis, because your first part of diversion is your CIT trained law enforcement. When they can recognize and help people move away from it. And I think it'd be safe to say we've all had either personal experience or some level of experience to know what it looks like as somebody going into crisis. And in so many instances, they've moved away from their treatment, they've moved away from their medication, and the answer is quickly get them moved back that way. The first center that we saw is, they call it a living room model, and it's where people can self-report to be brought by law enforcement, and their design is they can stay up there to 23 hours, and they get stabilized to where they can return back into their community without having to go into full crisis and then demand or have a need for those services. That's become a burden on, I know, the Chancery Clerk's office and on our courts. And the model that the county is contemplating right now would serve as a single point of entry, and it would serve as a point of diversion. And I would say, and they're going to provide us the data. That was one of the things I asked for. Show me your data of what it looked like before this was in place and what it looks like afterwards.
As it refers to
Committals.
commit,
Yes, sir.
did
But-
it help?
Yes, sir. Their reflection on their data without throwing it in front of us was obviously, yes, it has had a huge impact. And this community, I think the realistic catchment area, they said, was about 2 million. 2 million people. 2 million people. And while they couldn't tell me what their number of committals were, they don't talk a lot of committal up there. They have a lot of, this one place we went to, the first place we went to, is they're up to 23 hours. Then we saw another model where it's very much like a doctor's office, where a person who is moving towards crisis will go in, they sit in one room and all the providers come to them, and it's a 90-minute turn time of stabilization and getting them back out into the community. And all these pieces are to do it. So I'll say all of that to kind of give you where the lay of the land is, what we saw there, and then what my intention in my duty and service in this position is going to be. But I would like to hear back from y'all to make sure I'm charting on what you were looking for from me. But right now, I will tell you, there's not a healthy relationship between our Pine Belt and our Chancery Clerk, because there's aggravation, and I understand that. We got to get to a point where we can sort through that, because we've got to get to where we can look at our numbers, figure out what's right, what's wrong, and which way we need to go. I know there's a lot of question as budget on their side. I'm still digging into that part. My intent is to come back and give a better overview on that once I feel comfortable in what I'm talking about. But to me, once we resolve that, it doesn't change what our challenges are. And we've got to be ready, okay, once I've answered those questions about it, okay, so what do we do? What is the best thing we can do for our citizens in Harrison County as we move forward in trying to address it? Because the lingering issues that are going to be affected by this is the homelessness that is in our streets and how you affect that. You know, and that's spawned, I think, the national average, and I don't think we deviated from it too much, is 85% of your homeless have a serious mental health issue that's going on untreated. And that, you know, that creates a challenge for the system. We've seen a big rise in addiction. We have a whole piece of our workforce that, because of opioids, is out and not participating in our workforces. And so as we contemplate what it is we need to go forward and how is it best that we spend our tax dollars addressing these issues, those are some of the things I'll have in the back of my mind. But having said all of that, I'd kind of like to hear from the board as to what y'all are looking for from me on this.
Well, from my perspective, Leonard, I guess I'm looking for some relief because we've got a reduction in the CSU beds. We had, I don't know, the last year or so, we've been at 12 rather than the 16. And of course, that has costing us additional funds. We've contributed to Pineville, but we're not getting the full services of the CSU because we can't get the beds for whatever reasons, they can't staff it, or whatever the problem is. We're paying an additional, I think we're up to over $130-some thousand this year we're paying for that overload. So from my perspective, I was hoping that the diversion center, whether directly or indirectly, would assist us in that, in the sense that we wouldn't be paying additional costs for private hospitalization, for commitment, for the commitments that we're having to pay for now.
Yes, sir. I certainly, I'm of the belief any actions of diversion, keeping people from going into crisis and demand, and I hate to say
Right.
demand, leading to the actions, the committals,
But
is a good thing.
you're saying that you believe that it would be an indirect effect by getting people earlier on or treating them, they won't be
Well,
necessary
and
to force commitment.
I would say this, if our focus is, let's keep growing our bed space to meet those demands so we can meet it without having to go private facility, I would caution us on that approach alone. While I think we need to do that, you also want to kind of turn the faucet down some too.
Well, that's what I'm saying,
Yeah.
by being indirect.
Yes, sir, yes,
They
sir.
don't have beds there, but by getting those people
Those other-
early on.
Yes, yes.
Getting them in there, you're gonna save from having to actually commit them to those beds.
Yes, sir, that's
But it
correct.
wouldn't hurt, to be honest with you, in anticipation, maybe to have a couple of beds at that diversion center that could handle that. And I don't know if that's part of what they intend to do.
There's some intended bed space, and I'll tell you.
There is,
There's some intended bed space at that facility. And one of the things we're looking at, and I know it was in the conversations while we were a group up there, is based on what we saw up there, kind of massaging the model a little bit, based on some of the things we saw, because we saw some good things, and that was the intent of the trip, is to get some takeaways. But in general, the model will be there, and yeah. But going back to your point, yes, it is a model of diversion.
good, because, excuse me, when we had the most recent meeting in reference to the diversion center, I apologize, I can't remember the doctor's name, but I asked a question about the CSU beds, or would they have some beds that handle that problem if it came up? And I kind of got the answer to, Troy, you were there too as well, and you, Leonard.
Right.
That was not what the diversion center kind of was for.
That's correct.
But she did say, as we're saying is, by having that diversion center indirectly, getting these people early, you wouldn't need them.
Yes, sir.
And she was and one of the things that, and she didn't have the data. She told me she didn't have the data to show that or prove that that particular diversion center that y'all visited, that diversion center had those same results, that they reduced the number of commitments.
Right.
But she was gonna get that. Did y'all get any information from them that they actually saw, once they implemented that diversion center, that the need for?
That was a
Commitment
request I specifically made while I was up there.
Right.
I'm
Did y'all get that?
anticipating getting those data sets sent to us. Lucas, I believe was his name, the guy that was over the facility up there. I asked him that.
Presently, if I may, thank you for serving, in this complex issue, but, basically, we have 16 beds and only 12 are being used. We have part-time, Mr. McAdams, I'm sorry, the Honorable John McAdams, tells us that we have, an issue with commitment. And I'd like to see a breakdown of, the money that's being spent in Harrison County, not Madison County, but Harrison County. And, exactly have her give us the reasons why they're not all, filled.
Well, she indicated there was a staffing issue, getting the staff there, it's not necessarily the bed, that's what she told us,
I know.
was that the staffing issue. But if we can,
But she had staff from 9 different counties that she could, she had Hattiesburg, she had,
Yeah.
different counties that she could pull staff from.
that's correct.
That doesn't seem to be as crowded as we are, and doesn't have the needs that we do.
Mr. President?
Yes.
Leonard,
Yes,
70% of the affidavit signed in the clerk's office is family members. So what role, if a writ is issued, would this diversion center play? Would it be where the sheriff would be directed by the judge to take them to the diversion center to get them evaluated there, and then assessment be held there within the hours that they hold them?
So I'm gonna respond in my capacity and not on behalf of Pine Belt, because I can't necessarily speak for how they would. You have a big educational piece. If you were to put a diversion center in place, you have got to educate the public is there. I don't know if any of you have ever experienced mental health issues in your family, but
Absolutely.
but a family that is dealing with that, and there's something weird about the mental health field. We all know when it comes to medicine, we all know, if you fell over, we'd all know, call an ambulance. This is what's going to happen. Mental health is very confusing, and you're taking on a confusing issue at a high stress time. So they don't know, and a lot of times it digresses to the point, and they know, well, I know I go to transfer court or something and assign an affidavit, and they're not realizing there's opportunities of other points of help. And so if you were to create a diversion center, you have got to have a huge educational piece and educate your community. This is a place, don't wait till it's all falling apart. And so
The whole problem is they're not cooperative. That's why they have to go get an involuntary process.
well,
So they are at wit's end,
mhm.
and I can understand single point of entry for law enforcement and ambulance and professionals that could divert this person out of the ER to a diversion center.
Right.
But family members that are dealing with psychosis happening in their household with a family member that they, it's a danger to themselves and others.
And I
And
don't.
That's what I'm saying. I'm trying to lead into the question. Educating them, they wouldn't get that person in the car and take them to the diversion center. Am I correct? Is that
It's,
what you're
well,
saying?
and when you say psychosis, I mean, if it's full blown out, it's in, yeah, I
That's what
agree.
happens.
I don't well, not all the time.
Well,
Not all the time. I would say, and Troy, correct me if I'm wrong, you still look at the data sets. Your officers are responding to mental health call. Not everyone ends up having to be committed. There's a lot of time your CIT officers do exactly as intended. And then I'll kind of put you on the spot, Sheriff, but if your officers had access to a single point of entry,
I agree with that.
you also need transparency. A governing body can't understand exactly every day-to-day operation unless they're told, and we're usually not told until it is falling apart. So that's another part of education and transparency.
I think that
not tracking
the
that.
question I think you asked me was the percentage that's not being treated by an ER or Gulf Coast Mental Health or CSU or anybody else.
Let me rephrase. Do you think if you had a single point of entry, you could divert more people from going to the hospital, going to committal, if you had a single point of entry?
Yes, yeah, without a doubt. But it also goes back on the laws that Kansas City has and the laws that we have here. So do we need to change to reform our laws to meet a different criteria that we can handle mental health differently or better.
I don't think there was a great variation in the location. I'll tell you the biggest difference is and people don't like to talk about this, but they have expanded Medicaid, so they're able to connect more of their indigent population to payer
That's a
source.
huge issue, and that's not gonna happen in Mississippi.
No, it's not.
It's, but
And that's one of the things that creates the burden on the county is that payer source situation for the
just
indigent.
make sure that the board understands this. Anytime we go out with somebody with mental health issues, I think I'm second in the state right now with CIT trained officers. We have a ton that, since I started this, we have a ton that are trained now in CIT. 100% of those people go somewhere. We don't release anybody on scene and say, okay, you're okay now, because we don't have that authority. So we have to put it with AMR, or we have to put it with somebody else. So,
And that's, when you say that, that's when your CIT officer has determined they're a threat to themselves or others.
yes,
But they are engaging with people in lesser crisis
they are.
situation
And those-
where, because of their training, they're able to get them in a spot where they can leave them
if they
there.
can be de-escalated on scene,
That's correct.
and they have the knowledge of CIT training to say, with a family member, to say, okay, this is your process at this point, then they allow the family member to take them from that point to go see John and get a writ done and so on and so forth, or steer them through the process. But,
Right.
but I would say the percentage is very low that happens. I mean, they're gonna go with AMR, they're gonna go with us to a facility somewhere. Who funds the facility that y'all are at? Obviously is Department of Mental Health funded or staffed place. Who funds that facility? Does the county and the cities do it, or
The funding was interested, and I don't know if I fully captured all their funding sources. It is a state building that is being rented by the city, and then they have 3 major hospitals in their catchment area who are paying into it. Because the hospitals see the return on a diversion center.
space in the ER?
That is correct. And then, of course, they have the grants, mental health grants and other state monies that come in. I don't have the exact breakdown, but that's one of the things I want to try and get. Like I said, the data set that you were asking about, how many diverted out, and then the financial breakdown of them, and then that's Supervisor Rocco on the phone. And then, of course, she's asking for a better understanding of the finances of Pine Belt and how those monies, how the Harrison County money is being used.
I'm gonna say this, and I'm probably gonna get in trouble for saying this, but I'm gonna say it.
Hear me?
Yeah, go ahead, Connie.
I'm sorry, it's real hard to hear you, and I'm doing the best I can. If we can, get a total breakdown of the administration all the way down, from the top down, how it's administered, who do they pick to be their administrator? Does it come from the state? Do they follow the rules and regulations? A complete breakdown, if we can get it, of their structure, their administrative structure.
Yes, ma'am.
Sheriff?
The
I'd like that. I'm sorry.
The Department of Mental Health is, they see the need for mental health in the state of Mississippi. And if I'm wrong stating this, then I will stand corrected if I'm called upon. But Department of Mental Health, with everything that they went through with the DOJ and everything else, they started leaning on community mental health. So community mental health came back to us, to where they come into our communities and we pay a lot of money for mental health in our communities. The hospitals are overrun in their ERs. They need space. They need bed space for emergencies. And I hate to say that mental health is not an emergency, but theoretically it is. But it's not a medical emergency where somebody's gotta have surgery or somebody's got a doctor on, to look at them immediately. So with that said, to me, from just the outside looking in, Department of Mental Health, the state of Mississippi needs to step up more in their funding to fund community mental health, rather than relying on the counties and the cities to do this. That's why I asked you, where the money came from. And first thing you said was it's a state building. It's a state building that they're renting to the county, and that to me, that's a problem in itself.
I don't disagree with you, and again, okay.
And if somebody's watching that wants to correct me, but I'll take it. But
I'll give you my
I just think that they're not stepping
personal,
up to the plate like they should in the state with the budget that they have to support community mental health that they want to call it.
my personal opinion, this isn't on behalf of anybody but me, on that issue, is in 2011, when Department of Justice came in and told the state of Mississippi, you have got to quit your long-term institutionalization and all of these things. You can read it in that letter, and you've got to move to community-based solution mental health. I don't think the state did a decent job of responding to that financially. And in follow-up to what the sheriff's saying, if your organization is funded and constructed to run centralized mental health, and the state is saying moving it to community-based, the money should have followed.
Exactly.
And if you look around the state of Mississippi where the community-based brick and mortar is, it makes absolutely no sense when you look at our populations. And back in 2016, we asked for a study, and I've asked, and no one's run it yet. Let's do a study and see what our population needs in regards to mental health infrastructure. We know it's not enough. But what is our goal? What are we shooting for? We don't even know that. Y'all are operating in the blind on that, and it's not fair to you. It's not fair that Harrison County Board of Supervisors is trying to figure out the financial solutions to this problem. That money should have followed us here. And that's for a bigger conversation.
100% agree.
And so in the interim, we have to look at what can we do best with what we have.
Mr. President, one more question, I'll leave Leonard alone. Okay, what we deal with Pineville, CSU, is when they're full, or whatever reason, they don't take someone. Is that gonna happen with the diversion center under their management? Is there a limit to the living room approach as far as individuals that are there via law enforcement, ambulance, firefighters? Is that gonna be like 16? Are they gonna say, sorry, we're full?
It's a great question. It goes back to what I just brought up. What is our need? I will tell you, when Angela and I were in Kansas City, for 2 million people, they have 18 spots
Loud chairs.
in their chairs
Right.
for that size population. And that was one of the things we even talked about. Maybe the size model we're talking about may be a little bit big for us. So what are they going to do when we turn? Everything has bandwidth. We know that. His jail has bandwidth. Everything has
The
bandwidth.
point I'm making, law enforcement goes there, they say, no.
Can't take it.
They go to ERs.
I think your advantage to this model is it's you're not locking up a chair for 5 days.
2 days. 23 hours and
23.
59.
23, well, and that's why the proposed model has that living room model, 23 hours. If you need to move to bed space, but you don't need the acute care in a bigger facility, that can take you up to 3 days. So the intent of the model is to relieve the system. Will it ever hit max capacity? Probably. I mean, remember, we're one good hurricane away from a lot of people showing up and our homeless population going up.
So we're
It's,
talking about a diversion center for 5 cities
Mhm.
and the county. So there, I'm telling you, from what I've witnessed the last 2 years, where do you put them when they in need of help? And so it boils down to my office trying to place the individual. Let me get back to that. Pre-hearing for a writ, it's no responsibility of the state or the CSU to house that person for assessment and pre-evaluation.
okay.
So after hearing is where the problem has been also, is that after they're committed, there's no bed placement here for Harrison County for their responsibility to treat that individual. It's a Harrison County's responsibility. And the board went to contracts with the private facility.
Mhm.
So my point is, I don't know if there's a capacity at the single point of entry. Is there gonna be a capacity? Do we send the writs there? I think that would be the ideal way to operate, because CSU or Pine Belt could send someone there for the evaluations, and then psychiatrists and the doctor can do the assessments there. Because you have 8 beds, am I correct?
The model being proposed, the only thing, and it would not be appropriate for me to respond to that because I don't know enough about the subject
I don't
matter.
either.
But what you're
Let me
contemplating,
take- if
you're
I
kind of
may-
apples and oranges.
If
a
I
little
may,
bit.
But I want to take off on what John's saying. When the diversion center, we were first approached about a diversion center, that was my understanding that we would get the relief that John is talking about. That when people showed up there, they was gonna have a bed, a place that was needed. Then when we had the meeting the other day, I was divested of that, opinion, that was not necessarily what it was gonna be. Exactly what John's asking about, if I understand correctly. Bottom line is that we've increased our funding to Pine Belt, yet we still having to subsidize that funding through those private hospitals. So my understanding was the diversion center was going to give us some relief from that.
Yes.
Now, I'm not sure, and that's what John's asking, and I'm asking, are we gonna get some relief from that? I don't wanna commit to $1 million or whatever it's gonna be, if not
It'll be
more,
more
to
than
provide for this diversion center, the facilities for it,
Mhm.
that's gonna actually come from Harrison County's ad valorem taxes, his budget, and still be in the same position 2 years from now, showing up and saying, we don't have no place, or we don't have this
So,
reason or that
Did they have
reason.
an overflow method up there?
We gotta have some relief.
Did they have an overflow method up there where they sent private entities?
Well, we're talking about different things. Okay, let's say Pine Belt was operating all 16 beds. All 16 beds were up. You still just have 16 beds. I think you would agree 16 beds is not enough.
No, not for Harrison County.
You agree with that? Well, and we say not for
It's
Harrison
three
County,
counties.
but those 16 beds are to facilitate, it's not just Harrison County, it's for 3 counties.
Right.
So we agree. So even if we shore up the 4 beds, we go back to the same conversation. Because as we know, CSUs are based on 16 bed increments. You can only have a max of 16 beds in one, and then you have to build another. So is our next conversation, so we've closed the gap on the 4. Whatever the problems are, they hired, they get it filled. Then we got those 4 other beds. We're same place. We got too many people coming into the system.
Well, that's what we're saying. We're back at the same place, but we're spending over $1 million again.
Well, my
And
point is,
we're back in the same
let's
place.
see,
and the Board of
they
Supervisors
closed
are
that
spending
gap.
$1 million.
well, and that's my point. So they closed the gap. Let's say they do it and you don't have to pay them another dime. They get that gap closed. They finally get everybody hired. I think we can agree we're going to still be in the bed space problem industry. And so we're going to look at, so do we try and build a CSU strictly for Harrison County, which would be very, very expensive? Or do we start looking at methods to divert people from getting into the system? Because it only becomes the Harrison County tax dollar right now at the point of commitment, correct? If they're not committed, if they voluntarily go into medical.
If they're indigent and no payer source or no payer funds, it's the county's responsibility. If the state does not have a bed.
And I'm sorry, I'm not asking my question right.
Oh.
It only becomes the burden on Harrison County if someone is committed and they don't have a payer source? Or are you saying if someone is voluntary in our county, Harrison County has to pay for it?
Well, if they're voluntary, that's something that we play no role in.
That's my point. So the more we keep out of the business of committing people, now you're going to have to. We know there will always be a need for commitment, but the more we divert out, it doesn't go on your tab. And that's, now, in theory, you could say, well, yeah, it is, Leonard, because you're saying help build a diversion center, and that is, and it is, that's an expense there, but doing nothing, we can expect more of the same. Getting the extra 4 beds isn't going to close out our problems. We're still going to have these conversations. And I'm not sure which way y'all want to go. If we want to pursue more beds, then that'll be my role. I'll try and help us pursue more beds.
May I say something real
May
quick?
I ask you a question, though?
Yes, ma'am.
Would not, if we could, if the state would open up Medicare, or Medicaid, I mean, for just, even just for mental health, would that not alleviate some of the issues that we're having? Because they would also cover the private hospitals for the non-payers?
If you're asking if the state got expanded Medicaid that covered mental health, would it relieve the financial burden on the county? I believe it would.
Because if no one's covered by Medicare 18 to 64, and that's a huge part of the population that's affected.
Yes, ma'am. But yes.
That's a political
Okay.
question that we can't answer
Well-
here
And
anyway.
then we would
It's
have
ultimately
capacity
the
because
CSU.
to take people that are committed, we'd have capacity because the private hospitals would have no issue taking a paying customer, correct?
Oh, I agree. I think with private hospitals, you have all the bed space you need in our community. We're just talking funding.
Well,
Okay,
I'm
Tim.
sorry, Tim, I'm gonna shut up.
And the funding, would you answer that, though? I didn't hear that, because I'm sorry that I'm not there, but I have COVID, and so you don't want that. So, can you
If you expanded Medicare, you'd have more funding. Yeah.
expand it?
Yeah,
That helps it, helps
If
the
you did.
situation?
yeah, if you did, but as a politician,
gonna
I think
happen.
you know that lift.
That ain't gonna
I
happen.
can't hear
That's
hard.
not, that's not gonna happen, Connie. The expansion of Medicaid is probably not gonna happen. It could, but it's probably not gonna happen.
But if we're just about in, if we're in dire straits down here, I don't know why, because it's indirectly, it's taxing our people.
You can't expand
And
Medicare just for
it's
one
happening all over
county.
the state. I
You're not
think
gonna do
today,
that.
most
No,
of the
they're not
mental
gonna do
health, people are being held in,
Get that, you have
the
population
patients
about
are being held in
300,000.
Yeah,
jail.
they'd move in
Am
here.
I right?
Yeah.
Smaller areas that have no resources.
Right.
May I
Right,
say,
okay, go ahead, Tim.
my concern with Pineville,
But anyway, did he answer my question? I'm sorry. I didn't
Yes,
hear.
it did.
Yes, I think he said Medicaid, if it was expanded, it would definitely help, but it's not likely to happen.
my concern with Pineville
All right.
is we have 16 beds. And for a year, we've listened to them tell us that they can't fill a position to make it 16 beds, they only can have 12. Those 4 beds cost Harrison County a lot of money because they're going into private facilities. Even though we're paying for
Did
the
you hear that
bed.
person at all?
That's 10,
Tim.
I'll speak up.
the 4 beds, the 16 beds
Mhm.
that have been empty, we've had 12 since Pine Belt took over. Pine Belt's told over and over again that they can't hire people to be able to fill the 4 beds. Well, those empty 4 beds cost Harrison County money, and if those folks are being sent to private facilities. I don't understand why they can't fill those positions. The second issue they said was people that exhibit violent tendencies, they don't have security. My understanding from one of the meetings is they got $400,000 in grant funds to provide security, but at the last meeting, they still hadn't hired security. So they still can't take anybody that exhibits any type of violence, which to my belief, that's common when somebody's in that condition, that they have to be committed, that there's some violent tendencies going along with it. But I don't understand why they can't, at least I realize we may still need more, but right now we're at 12. Those 4 beds mean money,
Mhm.
taxpayers' money to the county. And I don't know how much they'll say, they have to hire, I think they said 2 employees they needed, or 3 they needed for a shift. I don't remember, it was
It's 4 employees
4 employees.
per shift,
And so,
and it's text, anyway.
I mean, it's just something that to me is a mystery as to why that can't be solved. And then the other issue is, then what do you need outside of that? My understanding is the county had agreed previously, we would lease a building for them to run a diversion center. And that those beds would be available as overflow from CSU, because you could have a separate
That was,
CSU
that
up
was
to
the
16
understanding
beds.
when we
Okay.
made the commitment.
And so, if that needs to happen, that needs to happen. If there's a space there, we looked at the hospital, and unfortunately, the gentleman there got killed, and that stopped that discussion for a little while at least. But I just don't understand why they can't do at least what they've got there to deal with the facility with the money that the county's devoted to. This business of, I guess I can say it this way, I'm tired of hearing that we can't hire somebody.
Right.
If you can't hire somebody, then you're not paying these folks enough money to decide they want to come work there. So pay them the money you want.
If they can't hire somebody, Tim, they can cut our costs to them, and we can use that money to pay the private hospitals.
And another thing is accountability. Where does the county's money go? Where does the county's money go? We don't have, anything they've sent us does not tell us where the county's money is going, so we can see with the benefit that the county's received from it. They gave us, last time that was asked, they said, well, you've got our budget for the whole Pine Belt. Well, that doesn't tell us where the money goes.
Right.
We don't have a budget.
They did give us some budget, it wasn't enough.
No, they didn't give you a budget, they gave you a brochure.
Yeah, that's right.
And it was an annual report on a brochure, nothing in writing, so.
And I'm not complaining to them about that, we just don't know.
I
And
don't
the county
know.
doesn't know.
I
The
mean,
sheriff got it when he was on there.
Yeah.
And sent it.
When I
When I
was
got
on
home,
board, I
there was a
emailed
packet of
all
information.
every time
my
about
house.
the budget and what was
I
spent.
thought I saw a budget, but,
Yeah, you
Yeah, I
did.
sent it
From
every
him.
time,
for them,
I mean, not for the county, but for the whole Pine Belt.
for the whole
Yeah.
Pine Belt, I sent y'all the
No.
financials every single
So you
time.
can't tell where, if the county's money is going to administration and other counties.
Mr. President, one more quick point I'd like to make. Voluntary commitments. I've witnessed Jones County resident coming to our CSU voluntarily. I've witnessed other counties coming into our CSU. Now, we're in a crisis for beds. I understand that CSUs do cooperate amongst each other when they have empty beds. But to me, a priority would be what the situation the Board of Supervisors is dealing with is, prioritize the county residents in Harrison County, in Hancock and Stone. Voluntary, I'd like to know if you could find out the percentage or payer source. Do they put a voluntary commitment or admittance if they're indigent? I know they're required, am I correct, to treat the indigent voluntarily?
I believe so, yeah.
I'd like to know the percentage that they've done that, as far as indigent. So the problem the board has is indigent commitments that have no payer source, and they're footing the bill when there's no bed available with the state or with CSU. That's the biggest problem, and I think Pine Belt could meet with this board and say, this is how we're gonna address that issue. Instead of telling, hey, we're spending $11 million in Harrison County. Okay, where and how? But that $11 million is from a lot of state and federal funding, am I correct? For services. So I think that they should divert that 2.1 million that Harrison County contributes to involuntary bed placement. That's my opinion.
Okay.
You got it, or do we get your court reporter?
I'm writing as quick as I can.
All right.
You don't want to change your mind, huh?
Sir?
You don't want to change your mind, huh?
No. I signed up for it.
Yeah.
Okay, any final words?
Just going back over, one of the questions y'all want is on the gap of the 4 beds, when's that gonna be closed out? When will they be able to provide 16 beds? You want an accountability of the county dollars that are going into Pine Belt and how they're being spent. And then, also, you wanted to know the percentage of indigents being taken by CSU as opposed to those with payer sources.
Voluntary.
Voluntary indigents. All right.
And if you have time, when you went to Kansas City, the administrative structure, how they're structured, so we can have an example of that.
Okay.
And I think, we need to know if the diversion center is going to give us some relief
Okay.
in the sense of beds that are available. I know there's a benefit as far as your single source entry. I know that's important, but we need to know if this diversion center is going to give us some relief.
I think it
Or are
will.
we still gonna have to spend $200,000 a year for private hospitals?
Right.
But that, I guess that's bottom line, it's our cost as well.
I don't think that you're ever, I don't think that Harrison County, as large as we are, you're ever gonna get out of spending money for private hospitals. I don't think that'll ever happen. But I think with the diversion center, the way it's talked about and the way it can be formed, I think you can lessen that bill.
Well, that was, Troy, that's what I asked him, the data that Leonard first alluded to when he started talking to us, is it from that diversion center in Kansas. Did they have a relief from that? Did it
Yes.
help them as far as their beds? That's
And,
what I was
and, no, and I
asking.
want the data myself, but almost asked it word for word the way you just asked me, and they said without a doubt,
But
yes.
it's not a 6-month fix, it's a 3 or 4
No,
year fix.
I recognize that, Troy, that it's, the day that we write the check and they open the center, it's not gonna do it. It's a long-term solution because they're gonna have to deal with it.
Well, and
over a period of time.
it goes back to one of my responses over here too. There is going to be an educational piece. Because what little our community understands about mental health, we would have to educate the public of what this center does and how it can be used. And the whole thing is to reduce the number of people having to get the acute care of mental health in the volume that we're doing.
And I think the elephant in the room that, especially as it comes from the Department of Justice, putting the pressure on the state and all that, is the fact that there should be a recognition, no matter what you do, there are people that need to be confined. mental
can't
health
use that
issues.
word.
I'm just telling you, we all know that there's certain individuals out there, y'all probably deal with them all the time, Roy, and other police officers. There's really no solution.
There is a
Community-
population of
community
people that it's
there are a
difficult to rely-
population of
yeah.
people
I-
that God only knows the only solution is to put them in a place and help them. And it's a long term. And we're not doing that, and those people are causing us the problems out there, mostly. That's the violent ones maybe that John is talking about all the time. I don't know. I just know that there are certain people, criminals need to be confined. And I don't care what you do for them, try to rehabilitate them, it's not gonna happen. And it's the same way with some mentally ill people. I'm not a psychiatrist or a psychologist, I don't know, but I have sense enough to know that there are certain people in our society that needs to be in a place controlled for long periods of time.
I would equate it to medical. There are some people that need longer terms of medical attention
Sorry, did we
than
ask,
others.
I can't hear
Yeah, go ahead.
there. Did we ask for a breakdown of, how many paying and non-paying individuals
John has that.
are,
Right.
how much in the bed, and how much time they'll charge us, and yes for that?
Don't understand.
We
the
get
question.
They
that.
charge us.
We get that, Connie. We get that from John.
But I don't hear that well when it gets away from y'all, I can not hear that well. So I was just trying to make sure that we did that we asked for a breakdown to find out on, the expenses and how the expenses.
Yes,
Take
Supervisor,
place.
Supervisor Ladner was indicating, we get that from our,
Well,
From
it's
transfer.
talking about how to spend the money for Harrison County, and I think Tim brought that up.
Yeah.
right,
Yeah, I think he's got that.
okay,
Just wanted to make sure we had that.
right.
And John, is there anything else? There was a couple of other questions that we talked about on the phone. I can't remember at the moment.
We're back to talking?
You know we're back talking. Shut up. Shut up.
Okay, you have anything else?
No, sir.
Anything else?
Okay, thank you so much, we appreciate it.
Thank y'all.
Thank you.
Y'all take care.
Serving on the board for us.
Thanks,
Thank
sir. Good to see
Did
you.
you hear me?
Yes, we did. Thank you so much, yes, ma'am.
Okay.
Okay, moving on, who I want to recognize, newly city manager from Diablo, Mr. Bobby Weaver. Thanks for joining us. Number 8, order approving mileage reimbursement for justice court employees as listed.
Motion.
Being second discussion, all in favor of the motion say aye. All opposed, motion carries. 9, order approving travel for Teresa Hydrick, Kelly Henderson, and an inspector of the code office to attend the building with officials Association of this city 2022 winter conference to be held November 30th through December 2nd, 2022 in Natchez, Mississippi. Motion.
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 Second discussion. All in favor of the motion say aye.
Aye.
All opposed, motion carries. Order approving work authorization 22001 with Tulsa Consulting Services 2 LLC to develop RFP specification for a managed service P25 public safety radio system and provide professional technical support services as requested by the Harrison County, recommended by the Emergency Communication Commission. Motion.
Motion, second discussion.
Second discussion.
Oh, where are we on that? I mean, Matt.
Yes, sir.
God, we've been dealing with this for God knows how long.
So this is following on,
When will we have it, I guess is what I'm saying.
yes, sir. This is following on our discussion at the budget hearings last month. So we are positioned now to go into development of an RFP for the managed services. We looked at all those options for the new radio system, decided that we wanted to move forward on the RFP. We're just going to need a little help writing the RFP from the technical standpoint. We have our contract with professional services for that, and so this is to authorize the work to do that, sir.
Have y'all had any discussions whether you're gonna buy these, radios, or will you, I guess, lease them?
So this
Have
is.
y'all had any discussions with that? What's the best way to go?
Yes, sir. We looked at those options in the budget hearing last month. So this managed services approach, which is a new option, was not available in previous years, would be contracting to have the service that the first responders radios would connect to, where we would not own the equipment ourselves, much like the cell phones that we all use today. So this would be writing an RFP so that we could get proposals from companies on doing that service approach, sir.
And in fact, that would avoid what's happening to us now. We still owe for radios that are antiquated.
Unfortunately, yes, sir.
That would help, that would keep that from
It
happening.
would prevent that in the future, yes, sir.
Might cost a little more.
We think the costs are going to be comparable or maybe even cheaper going with this approach because we don't have to upgrade the equipment along the way.
I was just wondering about it.
One more thing before we step down as a sidebar. Storm is out there now. Any information you can give us on that?
I am very glad to be appearing before you today talking about radio systems and not the danger from the hurricane. So unfortunately for our neighbors in Florida, it looks like they're going to have a tough time with a major hurricane approaching the Florida coast in the next few days. We'll see a little bit of impacts, a little bit stronger winds, maybe some rip tides in the waters, but it looks like the most significant impacts are going to stay to our east.
This might be a good time, Mr. President. Is Pat here? Pat? Yeah, Pat, that we addressed what you requested and giving you.
Yes, sir. We would like to ask the board for permission, if we get EMAC from the state of Florida, to send a team of people to assist them. We've got a package and a plan that we can use our EMAC assets, we can use our assets in the fire service to send them to back up Florida and be covered for payment on all of that for personnel, equipment, and all of the things that we have to do. So it would take nothing away from Harrison County, but it would add, like we went to Houma in Louisiana and assisted them and protected them until they could get back on their feet. Plus, we got the reimbursements and it didn't cost us anything. So we're asking that the board give us permission to do that if it comes up.
I'd make a motion to that.
Second the motion.
Okay, all in favor of that motion, say aye.
Aye.
All opposed, motion carries. Thank you. And then number 10, right, we got a motion and a second. Is there any further discussion on number 10, item 10? If not, all in favor of that motion, say aye.
Aye.
All opposed, motion carries. Thank you. Order, next, number 11, order approving Tetra Patterson Newport DYS Counselor to attend the SVN conference to be held October 11th and 13th, 2022. At a council 425 held from 012-191-486.
Motion.
Second discussion, all in favor of the motion say aye.
Aye.
All opposed, motion carries. 12, order approving travel and county vehicle for Gene Fayard and Joe Dobson, mosquito control to attend the roundtable discussion on drone use and mosquito control to be held October 18th in Baton Rouge. Motion.
Motion.
No cost to the counties. Second, all in favor of the motion say aye.
Aye.
All opposed,
Aye.
motion carries. 13, order approving craft fair to be held on October 21st, 2022, East Blessed Senior Center, with all proceeds being used to support future activities at said senior center.
Motion.
Motion.
Second,
Let's do that.
all in any discussion? For discussion, all in favor of the motion say aye.
Aye.
All opposed, motion carries. 14, order authorizing reimbursement to general fund 001-458-401 in the amount of $8,044.28 from RSVP Grant 19 SRM S001 for year-end adjustments.
Motion.
Discussion, all in favor say aye.
Aye.
All opposed, motion carries. 15, order concurring with the Chancellor Clerk on employment and personnel changes as on file with the payroll clerk and personnel and human resources department.
Motion.
Second.
Second discussion, All in favor say aye.
Aye.
All opposed? Motion carries. 16,
President,
order,
can I say one thing on this? That's a huge position.
I
And
can't
that
hear.
is a huge position that needs to be filled, but she does more than what this county ever sees.
Exactly.
John, I can't hear you.
Well,
it was-
Mr. President, the way the statute, it's private legislation for Harrison County to create this position. The senior judge selects the next public
I was gonna
guardian.
ask you.
And JD has said she'll stay and help as long as she has to get them acclimated.
Okay. Okay, number 16, order concurring with the county administrator on employment as listed and on file with the payroll clerk and personnel and human resource department.
Motion.
Second. Supervisor Rocco, can you second it?
I second
You
it,
can
I'm sorry.
Okay. Any further discussion? All in favor of the motion say aye.
Aye.
All opposed? Motion carries. With item 17, order spreading upon the minutes the personnel changes of the sheriff's office as listed on file with the payroll clerk. Motion.
Motion.
Second,
Discussion. All in favor say aye.
Aye.
All opposed? Motion carries. Order approving the purchase of 250 emphysema vaccines to be administered by American Analysis for Harrison County employees at a cost of $24 per vaccine.
Motion.
second,
Discussion. All in favor say aye.
Aye.
All opposed? Motion carries. 19, order approving the selection of SMPD&D to provide programmatic implementation for SWIFT grant funds and projects as recommended by the selection committee.
Motion.
Discussion.
second,
All in favor of the motion say aye.
Aye.
All opposed? Motion carries. Order acknowledging receipt of and spreading upon the minutes the official withdrawal letter from Landscaper Inc. regarding annual return bid group 10.3 dense grade crushed limestone 610 bid price $32 a ton, FOB yard, and $40 a ton delivered to any location in Harrison County.
Motion.
second,
Discussion. All in favor of the motion say aye.
Aye.
All opposed? Motion carries. Order designating any board supervisor, county administrator, purchase clerk, chancery clerk, or any department head as needed as board representative to receive bids for the metal roof and siding replacement for Harrison County Fire Service Station to be open on Thursday, October 20th.
Motion.
second,
Discussion. All in favor say aye.
Aye.
All opposed? Motion carries. 22, order designating any board supervisor, county administrator, purchase clerk, chancery clerk, or any department head as needed as board representative to receive bids for RFQ for professional design services for a new fire station at the training at the traditional community in Harrison County. Motion.
Motion.
Second.
second,
Discussion. All in favor of the motion say aye.
Aye.
All opposed? Motion carries. Now we recognize the sheriff.
Good morning. Total, we have 793, 34 misdemeanors, 121 females, 60 that have quit state arrest, and 24 federal inmates. One question I have for y'all is, Mr. President, is back on 17, the employment number 3, Sammy Thompson. He left with us in May of this year, and came back with us. What I'd like to do is if we can get his insurance waived for the 60 days. He's already in the system, so I'm hoping that it's not gonna be a big issue, but I'd like to get that waived if we could.
Motion to waive.
Second. All in favor of that?
Thank you.
Aye.
Motion say aye. All opposed? Yeah, motion carries. Thanks, Sheriff. 24, order acknowledging the receipt of Mississippi Leadership Council on Aging Grant application for the Sheriff's Office Triad Program and authorizing the board president to execute all necessary documents.
Motion.
second,
Discussion. All in favor say aye.
discussion. Does this have anything to do with, Janet Mayo's group?
I think that's the sheriff's
That's the
That's
triad.
That's the triad.
Triad.
That's for the agent where y'all buy the light bulbs and other things like that. I don't think that has anything directly to do with it. No, it doesn't, Tony.
It
They
doesn't.
can work together on it, though, if they need to, because they have so many, she has so much contact with the area, with the agents.
They do come out to the centers and offer the triad, and they also donate a lot of the,
But,
She's involved in it, yes. She's involved in it.
okay, thank you.
Okay, did we vote on that, 24?
no.
I didn't think so, okay. All in favor of the motion, say aye.
Aye.
All opposed? Okay, motion carries. 25, order acknowledging receipt of the award letter for fiscal year 22 Homeland Security Grant Program, grant number 22LE024, in the amount of $35,000 for a beach patrol vehicle for the period of September 1st, 2022, August 31st, 2023. Authorizing the board president to execute all necessary documents.
Motion.
Second.
Discussion.
That's for your,
It's a grant, yes, sir.
good.
Yeah, all in favor of the motion, say aye.
Aye.
All opposed? Motion carries. Order approving the low quote purchase for the Unique Collision Center, Inc. in the amount of $14,000 for the repair and paint job on the 1957 Chevrolet Bel Air, asset number 29690. Motion.
Motion.
Second.
Second.
Discussion. All in favor of the motion, say aye.
Aye.
All opposed?
We bought a brand new one for only $3,000.
In 57? In 57?
1957, yeah, for $3,000.
Well, it's free, so we won't have much in it, but it's a free car.
27, order approving the purchase of furniture for CID at the Sheriff's Office in the amount of $15,201.28 from Gulf Coast Business Furniture and Supply Company, payable from 114-215-920.
Motion.
Second, discussion. All in favor of the motion, say aye.
Aye.
All opposed? Motion carries. 28, order acknowledging receipt of the award letter for fiscal year 22 for security grant program, grant number EMW 2022 P00158, in the amount of $150,000, 25% cost match, for a new boat for Marine Patrol for the period of September 1, 22 to August 31st, 25, authorizing the board president to execute all necessary documents. Motion?
Motion.
Second discussion,
Discussion.
the 25% grant.
We're paying that.
Y'all paying.
Any further discussion? All in favor of the motion, say aye.
Aye.
All opposed?
Aye.
Motion carries. Order authorizing the road department to place limestone around the gate, the Harrison County Sheriff's Office Water Center.
Motion.
Second.
Discussion? All in favor of the motion, say aye.
Aye.
All opposed? Motion carries. Third, order approving mileage reimbursement for in-county travel for the following employees.
Motion.
Second.
Discussion?
On that one, I was informed that items F, G, and H of that one are a duplicate of number 8.
Okay, item F, G, and H are duplicates of number 8 that we already
That
discussed.
you've already
Okay,
approved.
so we take F, G, and H out. Okay, we'll remove item F, G, and H. So all in favor of the motion, say aye.
Aye.
All opposed? Motion carries. 31, order authorizing disposal of assets per attached list and authorizing the inventory clerk to remove the same. Motion?
Motion.
Second?
Second.
Discussion? All in favor, say aye.
Aye.
All opposed? Motion carried. Order authorizing reimbursement of the road fund 150-00360 in the amount of $1,494.84 payable from general fund 001-520-581 for road repairs behind the soccer complex.
Motion.
Second?
Second.
Discussion? All in favor of the motion, say aye.
Aye.
All opposed? Motion carries. Order authorizing the reimbursement to the Bridge Fund 160-000-360 in the amount of $57.43 payable from general fund 001-200-639 for signs made Sheriff Work Center.
Motion.
Second.
Discussion. All in favor of the motion, say aye.
Aye.
All opposed? Motion carries. Order authorizing reimbursement to the road fund 150-000-360 in the amount of $119.38. Payable from the general fund 001-522-581. All equipment to Puckett machinery.
Motion.
Second.
Discussion. All in favor, say aye.
Aye.
All opposed? Motion carries. 35, order acknowledging receipt of the August procurement card payable in the amount of $700 from various accounts. Motion.
Motion.
Second.
Second.
Discussion. All in favor of the motion, say aye.
Aye.
All opposed? Motion carries. Order approving fiscal year end budget amendments, adjusting journal entries and interfund transfers if needed to close out fiscal year 2022.
Motion.
Second.
Second.
Discussion. All in favor of the motion, say aye. All opposed? Motion carries. Order approving the end of the fiscal year 2022 interfund loan repayments per tax schedule.
Motion.
Second. Discussion. All in favor of the motion, say aye.
Aye.
All opposed? Motion carries. Order authorizing interloan funds for fiscal year 2023 per tax schedule. Motion.
Second.
Discussion. All in favor, say aye. All
Aye.
opposed? Motion carries. Order adjusting, approving the payments of the following claims.
Motion.
Second.
Second. Discussion. All
Can
in favor, say.
can I comment on this real quick?
Okay.
The contract in this case required that they would only be paid for the contract in this case required they would only be paid for 7 days on a court order.
Here.
Contract for Oceans requires that has to be a court order approving the first 7 days. If it goes beyond 7 days, it must be an additional order. There's no reference to any order here, and one of these is 29 days, and the other one's 15 days.
I can get you the
Can't
letter.
hear. Can't hear.
Okay.
It needs an order supporting them. Do we have
We
order?
normally submit that with the claim, but the only way they get an extension is through court order,
That's correct.
and that happens on every case. So in this case, on these 2 cases, I'll get the backup.
But it has happened, huh, John?
Right.
You say it?
They don't just get an extension without asking the judge, and it's a professional in that facility that submits longer stay recommendations to the court. And we pass it on to the judge and they approve it.
Okay.
But we need to start including that in the order if we're doing that based on court orders.
It is.
Doesn't say that on here.
It should be in there, as per agreement, I think is how we do it. The Board of Supervisors agreement, which follows the guidelines of the agreement. So we'll get that language in there if you would like.
Yeah, it would help.
Okay. All right, is there any further discussion? All in favor of the motion, say aye.
Aye.
All opposed? Motion carries. Order approving trunk or treat to be held October 28, 2022 at the Harrison County Fairgrounds. Motion.
Motion.
Second.
Which one?
A second.
Second.
That's the second. 41. Any discussion? All in favor of the motion, say aye.
Aye.
All opposed? Motion carries. 42, order approving the submission of grant applications in the amount of $75,000 to Mississippi Department of Environmental Quality to fund the annual Bring It Household Hazardous Waste Collection Event at Mississippi Power's plant, Jack Washington Government. Motion.
Motion.
Second.
Discussion. All in favor, say aye. All opposed? Motion carries. Order approving the corporate service agreement between Harrison County and the USDA APHSIS Wildlife Services for the Beaver Control Program beginning October 1, 2022, and authorizing the signature of same and paid in the amount of $7,500.
Motion.
Second.
Discussion. All in favor, say aye. All opposed? Motion carries. Order approving road signage for the West Harrison High School campus as per the terms of the interlocal governmental cooperation agreement between the Harrison County School District and Harrison County. Motion.
Motion.
Second.
Second.
Discussion. All in favor say aye.
Aye.
All opposed, motion carries. Order amending file ID number 22-1648, order adjudicating tax sale of August 29, 2022 on tax parcel number 0413C 03018 000 for 2021 tax erroneous and thus void as ab initio and for related purposes approved on September 12, 2022.
Motion.
Second,
Second.
discussion. All in favor of the motion say aye.
Aye.
All opposed, motion carries. 47, order approving transfer for, all approving travel for Supervisor Connie Rocco.
You skipped one.
Did I skip number 46?
Yes.
Hmm?
Okay.
We skip-
Motion.
Okay, now we gotta go back. Order amending file, amending file ID number 22-1647. Order adjudicating tax sale of August 31, 2020 on tax parcel number 1410806101001 for 2019 taxes erroneous and thus avoided ab initio and for related purposes.
Motion.
Second? I'll second. Discussion? All in favor of the motion say aye.
Aye.
All opposed? Motion carries. Item 47, order approve the travel for Supervisor Connie Rocco to attend the deferred compensation retirement committee fall meeting to be held on November 16th through 18th, 2020 in Riverside, California, no cost to the county. Motion.
Motion.
Second.
Second.
Discussion. All in favor say aye. All opposed? Motion carries. Order approving travel in the amount of, approving transfer. I have to look at the figures again. There's a lot of money there.
Not going to the moon for that.
Transfer the amount of $216,712.34 to the TART fund payable from 001-121-957. Motion.
Motion.
Second.
Second.
Discussion. All in favor of the motion say aye. All
Aye.
opposed? Motion carries. Order now, order approving installation of street lights as listed. Motion. Second.
Second.
Discussion. All in favor of the motion say aye. All opposed? Motion carries. Order 50, order adjudicating and authorizing expenditures as listed as necessary to advertise and bring into favorable notice the opportunities, possibilities, and resources of Harrison County, Mississippi, including the county logo being displayed along with link displayed to Harrison County online. Motion.
Motion.
Second. Second. Discussion. All in favor of the motion say aye.
Aye.
All opposed? Motion carries. And that will be it. Sheriff, you have anything?
Yeah, just got one question about the bond money, bond issue we talked about for the academy. You got any idea when that's coming?
Now, he's asking about the bond money for the academy. We'll get on that.
Everything's been passed, or where is the status? This is on 15, 12 million, whichever one it was.
Oh, on the 15th, it's, the selection committee met, and so I would assume on October 3rd, you will hire bond, and, the board will hire bond counsel, and they'll proceed from there.
Right. The RFQs for bond counsel and financial consultant were reviewed last week.
Okay, Ms. Pam, you have anything?
I do not.
Supervisor?
I don't have anything.
Okay, I don't have anything. Supervisor Rocco, you have anything? We're going around the horn.
Okay, just one thing that, if we could have, our IT, Robbie, to put in a sufficient phone call-in, we need that.
We need to-
desperately, I
we need to
think.
go Zoom.
This one this doesn't work,
Okay,
doesn't work well at all.
okay, thank you. Anything else? Well, he's listening.
Okay, good deal.
Okay,
And we need to approve more money for him to do that, let's do it, because, we need it, cases like this, okay?
Right.
Thank you.
sounds good. Okay, John? you have anything?
No, sir.
Tim?
Two things. Tomorrow we have the oral arguments for the Mississippi Supreme Court on the RW development case. That's the one at Veterans Avenue, which we won last year.
No, not quite.
statute hearing?
We have the RW Development oral argument for the Supreme Court tomorrow at 10:30. That's the case at Veterans Avenue with the Secretary of State. I'll send y'all a link if you want to watch it, if you're bored. And then also, as I reported to y'all last week, the judge has entered the judgment in favor of Harrison County on the Aldridge Tidelands case. So that's 3 cases where the Secretary of State has been held: the Long Beach Resort case, Aldridge, and RW Development now, that where the county and or the cities were adjudged have the right to reclaim wetlands for various reasons without a lease by the Secretary of State.
Real quick, Jim, if you don't mind, on the RW case, it was Biloxi. Biloxi is leasing. Can you give me just a quick?
Quickly, if you remember, this is where RW Development requested or offered to build a handicap accessible pier at the Veterans Avenue pier that used to be a pier there, it's still the remnants of it, at no cost to the county, provided we give them a lease of that property to build that public pier. And the board approved it. The board's jurisdiction is across the sand beach from the seawall, and then the Biloxi can build the pier out into the water. Secretary of State contended they were required to have a tidelands lease to do that. And as we've said before, we didn't believe we needed a tidelands lease. That's what the lower court ruled, and they've appealed that to the Supreme Court. And so we feel strongly that the case will be upheld. Judge Slover wrote an excellent opinion in that case. It's also consistent with the Long Beach Resort case that the Supreme Court decided just a few months ago. And the ruling in the Aldridge case is similar to the RW, although it's a little bit different.
The justification was different, but.
Yeah, the Aldridge case, this is very interesting because the board needs to know this. The Aldridge case deals with a Spanish land grant piece of property. That property came about as a result of Spanish land grants to a man named Mathern. And it covers over 500 acres, all on Point Cadet. And so that ruling is going to significantly impact all the waterfront down there and all the way back around the Back Bay, if it's upheld, which we expect it will be. It's a little bit different than the RW case, which was purely a tidelands issue as to whether or not the county and or the city has jurisdiction to reclaim tidelands in certain instances without a tidelands lease. The Aldridge case has to do with Spanish land grants. You may remember the way the state owns the tidelands is when the state issued patents, U.S. patents to property owners, the state retained its right to the tidelands for the public. The difference is under Spanish land grant, the property was never owned by the United States, therefore there are no U.S. patents. And actually there is a U.S. patent on this particular piece of property, but it was after the Mathern land grant, by the Spanish land grant. So in that case, the court held that they were required to have a tidelands lease because the state never owned it, or the United States never owned it, couldn't give it to Mississippi. Interesting case. The court also ruled that all of that land down there at Point Cadet was a result of artificial fill for higher public purpose, the seafood industry and tourism, and therefore the accretion, the adding to the land in order to the uplands property owners, not to the state. And so both of those are significant rulings that all 3 of them actually are. And so that's it'd be interesting to see what the Supreme Court does with it, based on what they did in the Long Beach Resort case.
The Long Beach Resort case was based on a different legal thing.
It was twofold. It was one based on the fact that Long Beach had statutory authority over its harbor.
Right.
And the second issue had dealt with, there was already a lease in effect that the Secretary of State had approved. The court did discuss the statutory authority of a local entity to use tidelands, but they ended up deciding it on the basis that the Secretary of State had already agreed to a lease, and therefore the city could lease sublet it to somebody else without a tidelands lease. So they kind of partially avoided, they didn't discuss the issue about governmental entities having a specific statutory authority over tidelands in certain instances, harbors, piers, the beach. It'll be interesting to see what the arguments are. But if you wanna watch it, I'll send you a link. It won't last for probably 30 minutes aside to an hour.
Good job, Tim.
Thank you, so far so good. Did you want this brought up today?
Good.
Oh, what, Bobby's issue.
Bobby,
Yeah, we got Bobby's issue, I was about to forget, yeah.
Morning, thank you. On behalf of the mayor and city council, we're a little late to the dance, but we recently had approved a resolution seeking county support for the county's ARPA funds at a ratio of the 25% that the city is contributing to these 4 ARPA projects. Then an application form right now is through the Mississippi Municipal County Water Program. And we're just asking for that support of the ARPA funds that you have assigned through MDEQ, along with the percent that we have assigned. And it's just an application form right now, just being submitted in the portal. It would have to be awarded the project in order for any of the funds to be committed.
I guess, question that I have, Bobby, I'm not, we have ARPA funds and we're using those, and those are committed, or will be committed once we let some contracts on this.
Correct.
Now, will we have are we digging into those committed ARPA funds to back your,
I think what's
25%?
happened, I think some of the other municipalities and entities have seek similar support, and it may be at the end of the day what actually gets funded and what is available to participate in a funding support.
Yeah, I just want to, I just know that we have a certain amount of ARPA funds,
Correct.
and we're seeking state matching funds as well. And I
Right.
don't know if what we're approving is for you to take some of our ARPA funds for y'all's matching. Huh?
Sound,
Pam?
Yeah.
that's what.
And I
Tim,
think
Tim, did you review it and
I reviewed it, it's just a resolution saying they want county support to apply for ARPA funds is what he's got.
Right. And it
So
establishes.
I haven't reviewed whether or not that affects county ARPA funds or anything.
I don't have, if it's just for support for y'all to get some ARPA funds or matching funds, I don't have a problem with it. I just don't want it to, I don't want us to commit to giving you some of our ARPA funds.
Well, it does say that
It
the
does.
county's
Yeah.
going to contribute
And the-
2.25 million.
The resolution
if
is
they get
similar
the
to what
ARPA.
Biloxi has done, and we were just following that trend, but it does, we were allotted, the city was allotted X amount of dollars in ARPA funds just as well as the county has been, so it's just a committal that if, but I understand what you're saying.
But the state is having some matching funds, y'all should get them as well as us.
Right,
I
and
would
it's,
assume.
right,
And
it's a
if that's what
combination
you're
of city,
supporting-
county, and state match funds for the project.
Being the projects overlaid with some of the projects that, and Mr. Supervisor Morton, she can probably better explain it. I think in some of the cities, the county's gonna do some projects kind of coincide with the cities.
Mhm.
So, your project, do you know where it
it's
coincides with anything?
I think there's some overlap
It
as far
is.
as overlap for, especially in the sewer, water
I
and
was wondering
sewer
if you
issues,
had any.
there's overlap.
When I spoke with Ms. Martin, and I kind of explained the projects to her, she was in support of it, but obviously it needed to come here and get final approval. I'm not exactly what all the county projects are. I can tell you that one of the projects is for a new pump station up at the Highway 15 Laney Bridge corridor, which brings sewer down to the treatment plant. The objective is to allow the city to grow beyond the 1 mile certificated area in that situation. We've got 4 pump stations that we're going to reverse the flow to the north to go to the HCUA pump station and divert, with the objective being to take some of the flow off the southern part of the city. Because of the anticipation of more casino growth and whatever, we didn't want to over inundate the pump station down there. That replaced the treatment plant and sends all the sewer to the north. There was a water line across 10 to connect from the Sports Illustrated Mandel location to north to the promenade, and then the final project was to do some valve adjustments with the 2 water tanks to allow the water levels to be optimal and get the maximum support of the tank and control pressure. So those are the 4 we have.
I think think what we had, or what I had suggested to Luxie is that they sit down with Tim, Peter Abide sit down with Tim and our county engineers and work out all of the logistics of it, of what money goes where and who it affects and that kind of thing. I don't know if you've done that or not yet, Tim, have you?
I didn't know we were supposed to do that.
I'm not aware of any cooperative projects. Or, we do have some cooperative projects with the cities? Which one?
When we were finalizing the list, you know, the priority list with the 40 projects that the county had with the ARPA money, the city of Biloxi did submit, I believe it's 2 projects, I may be off, but I think it was 2 projects in which they asked us to pledge 25%. The state would do 50, the city would do 25, and the county would do 25. And those 2 projects did make your list. I want to say around number 15. I may be wrong. I don't have the list in front of me. I did not know. But those are the only 2 not done to commit with any other city. But you did pledge 25%, but that's in your priority list.
Well, if that's what Bobby's asking for, we need to know if we've got projects with the city of DeIverville the same way.
You do not.
No, they were the only.
You do not. The only ones that brought a request to you was the city of Biloxi. And now DeIverville has.
And, well, then, what he's asking for is us to
Include
some funds.
25%.
25% of his projects.
Yes.
He's asking us to pay participate in 25% of the project?
That was what was the request, and like I said, I know we were.
I think what I'm saying, Bobby.
I understand entirely what you're saying, I do.
The county has
I understand.
approximately about $40 million worth of projects.
Correct.
And if we've got to put up 25% of yours, then we're gonna have to cut back on ours.
I understand.
And that's what I'm trying to understand. You
And
follow
that
what I'm
was-
saying? Now, part of that 40 million, I'm using that figure, we know that Biloxi's in there. That's part of it.
Yes.
But now, if we do this with you, we don't know if we have those projects with the Iberville.
But we don't know if those projects are gonna be awarded by the state or accepted by the state. That was just, they made your list. You remember that list that Jackie formulated with those 40 projects? So you had 40 million in need. and
We don't know if we're gonna get the matching funds
That's
for those
correct.
projects.
That's correct.
Because we only considered what we already had, for example, in the bank. If I can use
That's
that
right.
terminology, the projects that we accepted was only the money, that we had in the bank, that's to pay for those projects.
We had,
See what I'm saying? And that part of that is the project with Biloxi. That there's am I understanding that correctly?
I think so.
They are on the project list, and of all those projects, each of those projects have a separate priority.
Right.
So, my understanding is the board was approving the top 14 priority projects, and then they were gonna seek, additional funding through the state
Through
with
the
their
matching
match
funds.
program.
If we get the matching funds, then we can do more.
So I
We
guess it
have
could be approved
submitted
contingent
one.
upon funding being available.
Right, okay,
That would be a
yeah.
way to approach it.
we've submitted more than the 40 million
Sure.
for the application. And we also.
Do I need to amend the
But we instructed, if I'm correct, we instructed Jack and them to proceed with projects that would estimate it to be the 40 million that we were assured that we have, and we can go ahead and get those projects moving
Yes.
and bid them out. So what I don't wanna do is commit to Bobby here today some 25% of his project, and we might not get the money. Now, if we get the matching fund, we're in good shape, we can proceed with more.
And if the resolution is contingent
So,
upon.
Bobby,
receipt
do you
of
wanna
funds-
add
Okay.
your,
Contingent upon, contingent
you wanna add
upon the
your
match.
projects to the 14 we already have?
We have more than 14.
Well, I think they have more than 14, so it would be added to their total list. And then subject to however any of the projects are actually awarded, at a later date. If funds
Yeah,
are available with
for
the match, you
example,
could
if we get
contribute.
the
That would be
available
acceptable.
additional matching fund, we can get with y'all, we can
That would be-
cooperate
that
with
would-
the project.
That's fine.
Those
Yeah.
applications have to be filed with the city.
This
Which
week.
was it said.
Right.
We'll put this in a motion, or?
You want to make your motion?
Yeah, I would say the motion be, as Bobby indicated, contingent upon us getting the matching fund.
Right.
Y'all help me out, because that's
It
the
just
way I
goes on our
understand it.
Right.
Okay, yeah.
All right,
Okay, I'll second that motion.
okay, good, you got that? Okay,
No, no.
okay, is there any
John,
further,
did you get it?
I think so.
is there any further discussion? All in favor of the motion, say aye. All opposed, motion carries.
Thank you all so much.
Tim, you have, well, you have anything else? Okay, let's get a motion to adjourn.
You got it. Motion.
All in favor of the motion, say aye.
Aye.
All opposed, motion carries.